Dear friends and colleagues, today we are going to speak about our own company Ethix Healthcare, where each and every one of us are working at present. Ethix Healthcare has got two good WHO GMP certified factories at Himachal Pradesh, injectable range separately for Maxwell and Ethix Healthcare for tablet, orals, solids and liquids and ointments. We should all feel privileged and proud that we are working in a company like Ethix, because ethics are in our DNA. That is the motto of our company. Ethix Healthcare has got a lot of products in the basket, around close to 450 products ranging from antibiotic range, diabetic, cardiac, pediatric, gynec, neuropsychiatry, ENT, Ayurvedic segments, anti-cold tablets, anti-ulcerative, and so on and so forth. The segment goes on. So we majorly cover all important core customers in this segment. We have a basket of products, and today we are going to take one bunch of basket, that is anti-infectives, or otherwise called as antibiotics, which in our basket we have got antibiotic by way of injectables and by way of oral antibiotic tablets and capsules. If we start injections range, we have good antibiotic like macrolides, that is AMACE 250 and 500, which is used for chronic kidney disease, respiratory tract infection, septicemia, sepsis conditions. AMACE is one of the excellent product we have in our product basket. If we come down to our ceftriaxone, that is third generation cephalosporin injections, we have our ethizone. Ethizone plain 1 gram injections we have got, which can be used for respiratory tract, urinary tract infection, skin and soft tissue infection, pneumonia cases. Also, if some doctors need a combination of beta-lactamase, we do have a wide range of beta-lactamase like Ethicef, yes, that is with sulbactam we have. We have Ethicef 1 gram plain ceftriaxone. We have Ethicef with tazobactam, that is also a beta-lactamase. We have that combination also, ceftriaxone plus tazobactam, cefiporazone plus sulbactam, lifezone, yes. So all these kind of combinations we have, and we have imipenem, meropenem range, that is we have Merzi 1 gram, a higher antibiotic range which is used in critical life-threatening infections. We do have anti-emetic injection, that is Emistop, to arrest the emesis gravidum immediately. We do have for gynecology segment, we have our injectable range Tranax injection to stop the menses bleeding. Heavy menstrual bleeding, this is one of the asset to the gynecologist, that is Tranax M injections. If we come down to the tablets or oral capsules of antibiotics, we do have quite a good range of oral antibiotics, starting from AV 400, 800, that is acyclovir, especially during measles, for smallpox, chickenpox, acyclovir will be given. Then come down to day-to-day antibiotics, we have one of the excellent time-trusted, accepted by the medical profession, the combination of amoxicillin with beta-lactamase clavulanic acid. Clavulanic acid is one of the best beta-lactamase available in oral preparation. We have the brand name of Ament 625. To the doctors who want the profit margin to be on the higher side, Ament 625 will suit their segment. If some doctors are so eager that they should pass on the benefit to the poor patient needing a lower MRP, we do have Ethimox 625 at a lesser price, which will be on a much better benefit to the poor patients, which will not definitely pinch the purse of the patient by keeping it at a lower MRP. These two benefits in a single product of Ament 625, Ethimox 625, we are giving to the medical profession. The choice is doctors. Again, coming back to other compositions, we have macrolides, Amity 250, 500, basically used for upper respiratory tract infection, lower respiratory tract infection, sinusitis, bronchitis, and also for skin and soft tissue infection, the drug of choice macrolides, the antibiotic which acts on 30S ribosomes and stop the protein synthesis. That product we have the brand name of Amity 250, Amity 500 milligram. And coming back to other antibiotics like quinolone group, we have the Oroflux. So Oroflux we have got in two strengths, Oroflux 200 and Oroflux 400 milligram. That is quinolone group of antibiotic. So these two segments of 200 and 400 strength will be definitely beneficial to the doctors, because you find many companies in today pharma marketing have got only one strength of Oroflux in 200, whereas in our kitty we have a basket of 200 as well as 400, which will definitely suit the doctors. According to the need, doctor can choose the option of Oroflux 200 or Oroflux 400 milligram. Not only that, we have Oroflux Poison, another excellent combination for aerobic and anaerobic infections to take care like diarrhea. That will be an ideal drug of choice like Oroflux and ornidazole. We have Oroflux Poison in our basket. So we have third generation cephalosporin, Ethix, that is cefixime. That we have Ethix 50, Ethix 100 DT, both are dispersible tablet. We do have a combination of Ethix plus, that's a combination of double antibiotic, cefixime with ofloxacin. We do have Ethix 200 milligram tablet, Ethix 4 to the brand name, which will be suitable to the adult segment of patients. So in Ethix, we have got a wide range. Also coming back to the another third generation cephalosporin, we have another segment that is in cephalosporin itself, third generation cephalosporin, that is mucosaph brand of cefodoxime. Even in mucosaph, we have got quite a good range which will suit the doctor, that is like mucosaph 50 DT, mucosaph 100 DT for the pediatric patient, mucosaph 4 200 milligram for the adult patients. Not only that, for treating younger kids, we have mucosaph 50 dry syrup and mucosaph 100 dry syrup. So this third generation cephalosporin of cefixime and cefodoxime, which are quite extensively used in the market, this product has got a wide potential and wide scope for our selling. And also we have, as far as oral macrolide is concerned, we have clarithromycin, which is better than erythromycin. We have the brand name of Clary, 250 milligram tablets to take care of the upper and lower respiratory tract infections, skin and soft tissue infections. Clary 250 will be an ideal choice. Now coming back to pain segment, pain management therapy. First of all, you would like to ask, what is pain? Pain is an unpleasant sensation, yet it is very important. We cannot neglect that it is just pain only, which in due course lead to lot of disturbances in the body. So we need to address this problem immediately. For this pain management therapy, we have got a good basket of products. That is starting from plain paracetamol, we have packed. We are one of the very few companies marketing paracetamol in a wider range. Not like many companies who have 500 and 650 milligram. We start right from the pediatric range like packed 125 dispersible, packed 250 dispersible, packed 500 milligram, packed 650 milligram. So we give a wider range of basket to the doctors. So paracetamol, which once again one of the fastest moving antipyretic in the market, if you give a good range in front of the doctors will feel, yes, this company are professional people and they are covering the wider segment of the public. Like patients who want 125 to 50 pediatric, they can go for packed. Adult patients can consume packed 500 and packed 650 milligram. So that is the range we present in a simple product like paracetamol. Now coming back to another pain management therapy, we have got a basket starting from aceclofenac, selective COX-2 inhibitor. So the gastric disturbances will not be there much when compared with the non-steroidal anti-inflammatory drugs like diclofenac and all. So aceclofenac starting, we have pain out MD, mouth dissolving, which ensures quicker onset of action and immediate pain relief to the patient by way of MD. So pain out P also we have pain out P, aceclofenac with paracetamol. So once again in pain out P, the biggest advantage is we have pain out P in two packings. One is pain out P in blister pack and another is pain out P in alveoli pack. So doctors are given the option, if they go for alveoli pack, they can take pain out P plus. If they want a blister pack, they can take it out or pain out P tablets. Also we have a triple combination of aceclofenac, paracetamol and peptidase. The brand name comes as pain out S. Suppose some people have got strain spines, we do have a combination of pain out MR, that is a combination of chloroxazone with aceclofenac. So pain out MR. So we do have another muscle relaxant thiocalcoside, along with the combination of aceclofenac, that is we have Fluxy 4-MR, Fluxy 8-MR, that is thiocholcoside 4-mg, Fluxy 4-MR, thiocholcoside 8-mg, Fluxy 8-MR. So like that of one aceclopara, we have such a wide range which can be presented to the doctors. We do have in pain management Loran Plus, Lornoxicum with paracetamol. We have Etoricoxib, the brand name comes as Ethix P, Etoricoxib 90 mg. Also we have in pain management therapy Etorix P, that is Etoricoxib with paracetamol we have. So like that the range goes on with a wide range covering the pain management therapy. If you want to go for anti-diabetic, we do have quite a good range starting from plain metformin like Merit-ER. If you prefer a combination with glimepiride, we do have Glimerit 1M, Glimerit 2M. We do have Glimerit MP1, Glimerit MP2. Like that the range goes with the combinations as per the preference to the doctors. We give a wider basket to choose from the anti-diabetic segment. We do have cardiac products like rosuvastatin, telmisartan, we have Telvel, Rosen or rosuvastatin, Telvel, telmisartan. In Telvel, we have quite a good range like Telvel 20, Telvel 10 mg, Telvel H we have, and also we have, if you go to atorvastatin beta blocker, we have Atotin 10, Atotin 20, Atlife A, like that the range goes on. So quite a good range of cardiac product basket we cover the cardiac segment of doctors. So we do have the range like, if we call it as Ayurvedic, we have that because it ranges from the Ayurvedic segment of doctors can be taken care, quite a good range of Ayurvedic segments products we have in our basket which can be used in day to day routinely by the Ayurvedic segment of doctors. Those kind of around 10 to 15 products we have in our basket. So if you go for a pediatric range of brands to cover the pediatric segment of doctors, we have Biotone TD drops, that is multivitamin drops, and also for the child to take care of the digestive problems, we have Enzovit drops. We do have Mcast 4mg, Mcast 10 mg, Montelukast in chewable tablet for slightly elderly pediatric patients. Cough segment, we have King Cough, an Ayurvedic cough syrup to take care of the cough. Cough is nothing but a protective reflex. So to take care of the allergic segment of cough, we have King Cough. So like that the segment keeps going and growing. Also we have topical itch out cream, and itch out is also available in our tablet form like itch out 100 mg, itch out 150 mg, itch out 200 mg for the antifungal segment. Also in Ethix we have quite a good range of brands to take care from the gynec segment of doctors, starting from menopause, Pregnical calcium citrate combination, then Besical calcium carbonate combinations which is in huge demand during pregnancy and lactation. In maternity segment we have our Mightyfer which is available, carbonyl ion containing best elemental ion of 33 mg. Also we have Cyclospas, an antispasmodic. We have Cyclospas M with muscle relaxant mefenamic acid to take care of the dysmenorrhea, painful menstrual bleeding. Also we have tranexamic acid, Tranex, to take care of the heavy menstrual bleeding, like so on and so forth. The segment of gynecs keeps growing and doctors have the basket to choose from the gynec products. Like this, Ethix has got a wider range of brands where each and every segment of doctors is being covered by our Ethix brands. So what we need to do as a marketing team, we have to sell all these good mega brands of Ethix in the market. First of all, we should understand what is marketing, what is selling. Marketing is a place where we need to sell the brands because every brand has got a market. Selling is selling those brands in the market. It is purely salesmanship which comes in the selling angle. However, the salesman is strong, he can add up some few things and present the product nicely to the doctors to get the doctor's attention and at last aim at a win-win situation by converting the doctors to these brands. So we in marketing in Ethix should know what are the brands we are telling to our customers, like doctors, like PCD segment of persons, like hospitals, suppliers whom purchase our brands quite regularly, and also doctor. We need to present our brands in such a nice manner the doctor will feel, yes, Ethix is a good company and Ethix has got good quality products in their basket, and at the same time Ethix brands will not pinch the purse of the patient, because Ethix gives all their brands at a quite economical rate, which will definitely benefit the poor patients. As far as Ethix is concerned, we do a great service of 1 rupee customer, like critical care customers, like cardiac and diabetic segment, which patient needs to take the drug till up to the death time. Once a prescription generated from the doctors, these patients can directly approach Ethix through our online, like Amazon, Snapdeal, Flipkart and all, wherever all our products are being posted there. They can approach those direct online marketing also and place their orders through those online. We will be able to supply at 1 rupee to those real genuine customers, because many of the times the customers purchase these brands and they start selling outside to aim at a profit. The aim of that 1 rupee totally goes down. 1 rupee means 1 rupee. It should benefit the poor in the longer run, because these kind of cardiac diabetic should be taken for quite a longer period of time. So by offering this 1 rupee per product to the customer will be benefited. The poor, real, good customers will be benefited in the longer run of taking this tablet at a very economical price. The human service we are doing to the public by way of 1 rupee to the customers. So Ethix customers or public can utilize this golden opportunity given by the Ethix. So grab this opportunity and really use this opportunity for a good cause, because no company gives product at 1 rupee. Everybody works on profit, but we in Ethix, apart from profit margin, we keep Ethix in our DNA. So we thought, why not we introduce a 1 rupee customer service to really needy and poor patient. The idea began this, we have come out with Ethix 1 rupee customer segment of our service. So I request you to use this 1 rupee segment of service very judiciously by the concerned public, so that both company also feels happy. Yes, we do give good medicines at 1 rupee to the real needy poor patient. Company gets immense satisfaction by offering this 1 rupee rate of cardiac and diabetic to the needy poor patients. So we all should feel proud that we are working for a good company like Ethix, which takes care of the employees and which is very much interested in the employees' welfare. So we as a marketing people has enormous responsibility on our shoulder to deliver the results back to the organization. After all, organization keeps marketing people particularly for sales, and these sales should bring proper revenue generation to the organization. In Ethix, there is a unique system of against advance payments. So once a sale performance generated, it goes to the concerned persons or the customers whom they transfer the money, and immediately the same day the stocks will reach the respective headquarters. This is a human service we are doing to this noble medical profession. And Ethix feels proud in doing this service for this quite a longer period of time by offering the products at really affordable rates to the medical profession. So this transformation of funds has been taken care, the product reaches the customer the next day. So what more we want? Customer also feels happiness. We as a people working in marketing also feels very happy that we are working in one of the very good organization in the pharmaceutical industry. Congrats, wish you a happy selling.